Thank you, Sarah. Thanks for the introduction. Thank you, everybody, for joining us today. Thank you, Secretary Torres, for being here. So I know that the vaccine distribution in Pennsylvania is going slower than any of us, all of us, would prefer. And that's deeply frustrating to all of us, but especially frustrating to Pennsylvanians who are in line and don't know when they're going to get the vaccine, or even if it is their turn, if the vaccine is going to be available. So let me just start by saying we all know that here in Pennsylvania we need to do better, and we are doing better. We're working on that very hard. Sometimes you got to take into account the comparisons that are made with other states. It's hard to make these comparisons when it comes to vaccine distribution because every state is different, and we all have different challenges. It's just like every community in Pennsylvania has different challenges. But just as an example, Pennsylvania has a larger percentage of older Pennsylvanians, older Americans than almost any other state in the country. I think we're second or third in the country in terms of our percentage of population who are older adults. But we still receive an allocation from the federal government based on our overall population. So we get a little over 300,000 doses now a week, and which is great. But that's for all of Pennsylvania, and that's taking into account that every Pennsylvanian is just one person. But we don't yet have enough vaccine in Pennsylvania to make enough available for the population that's in the 1A category, and that includes people 65 and older, as well as frontline healthcare workers and people in nursing homes, long-term care facilities. But just the number of people in that category, it's over 4 million, and that would be, if it were a separate state, would be sort of in the middle of the pack, would be larger than many states in the United States. So those are some of the challenges, among the challenges we face, but they're no excuse. We still need to make better progress. We need to do better to make sure that we get this rollout of vaccines as efficiently, fairly, and effectively as we possibly can. And we're making progress with this. We have more than 1.5 million vaccines have gone out already to over 1.1 million Pennsylvanians. That's first and second doses in some cases. The restricted supply of vaccine means that we need to work harder, though. And we need to keep working harder to make sure that our vaccine distribution actually is working for Pennsylvanians. Just this week, and we're doing things to do that. Just this week we launched the Your Turn Vaccine Eligibility Tool to help improve our vaccine distribution process. And with this tool, people who are not yet eligible for the vaccine can sign up to get a notification when they can be eligible. This is an important way for the Commonwealth to improve communication with residents about the availability of the vaccine and which distribution phase each Pennsylvanian falls into. And we're constantly changing, constantly reevaluating our process to find better ways to make it work for Pennsylvanians. An important part of improving our process is thoughtfully highlighting best practices, success stories from around the state, and trying to find ways to replicate those successes in other parts of the Commonwealth. We know that every community, as I said, in Pennsylvania has unique challenges and needs, but we can learn a lot from listening to one another and lifting up creative community-based solutions, things that have actually worked in parts of Pennsylvania. With that in mind, this presentation today, this press conference, is an effort to highlight some of the community-based solutions that are working. And Secretary Torres is going to talk about some of those things, things that are working right now. Throughout the Commonwealth, adults 65 years and older are eligible, once again, for the COVID-19 vaccine. And older adults can work with healthcare providers in their communities right now to make appointments with those providers when they receive doses of vaccine. Older adults in the long-term care facilities are getting the vaccine through the facility where they live and through the federal pharmacy partnership. But there are thousands of other Pennsylvanians, 65 and older, who live on their own or in senior housing and other settings that don't qualify them for the long-term care vaccine program for whatever reason. We also know that for older adults who don't have access to the internet, it can be a really challenging thing to go online to find providers in their area who have received the vaccine. And it's even more challenging to navigate some of the online appointment portals. While many older adults have a friend or a relative who can help them set up an appointment, some really don't know where to turn for help. Getting older adults connected to vaccine providers, therefore, is really critical and really important for us. And how well someone can use the internet should not determine when they get vaccinated. Older adults who have questions about vaccine availability in their community and questions about how to make an appointment can call the Department of Health hotline at 1-877-724-3258 to get help. But we know we need to do more. We know that folks need help getting appointments. They need help with transportation. They need help when it comes to answering questions, and they need help when it comes to providing reassurance. There are some creative solutions to these problems that the state's partners are providing through coordination with, again, Secretary Torres' Department of Aging. And he's joining me today, and he's going to be outlining what his agency and his partner, their partners, are doing to help older adults navigate the vaccine process by using relationships that already exist in communities all across the Commonwealth. The Department of Aging can marshal its resources to provide more assistance to older adults on a local level. And Secretary Torres is going to share some of these success stories. Community-based solutions like these are being developed every day, and my administration is working every day to try to make sure we have better solutions. We'll continue to lift up successes so that communities across the Commonwealth can learn from one another, but we can't expect a cookie-cutter approach. Again, every community is different, and the solutions that work in Butler County may not work as well in Luzerne County. But we can overcome the challenges before us by improving collaboration and coordination. And we should leverage the knowledge and experience of the people who know their communities best. So the local footprint, the local relationships, the local connections really do matter. So I want to thank the staff of the Department of Aging and all of the area agencies on aging for their tireless work. Thank you to our long-term care ombudsman, Margaret Barajas, for her work and the work of all Pennsylvanians supporting and helping our older adult population. Thank you to all who are stepping up to address a crucial need in their communities. Your work is saving lives, and your work can show us the way to a better process for all Pennsylvanians. So now, I'm really proud to turn this over to Secretary Robert Torres, the Secretary of Aging. Robert.
Thank you, Governor. Good afternoon. I'm pleased to join Governor Wolf to talk about what the Department of Aging and the area agencies on aging are doing to help older adults in obtaining their vaccine. Pennsylvania's older adults have faced many challenges throughout this pandemic, and we recognize the current frustration and anxiety older adults are experiencing as they await an open appointment for a vaccine or attempt to locate one. Since the first case of COVID-19 was announced, area agencies on aging have helped to ensure the needs of older adults are being met. Now, these agencies and their community partners are responding to the call to help older adults through this latest challenge. Depending on each agency's capacity and resources, they are providing connections and support in a variety of ways, such as coordinating with their local healthcare providers, county government, and emergency management agency, providing guidance and support, assisting with scheduling, arranging transportation, offering senior centers to serve as vaccine clinics, and participating in county COVID-19 planning commissions. This is labor-intensive work. This is person-to-person work, so it requires patience on everyone's part. Still, we are seeing some good examples of how steady teamwork and collaboration at the community level can make a difference. One model for this kind of teamwork is happening in Butler County. The Butler County Area Agency on Aging participates on a COVID-19 planning commission for Butler County, which is comprised of healthcare providers, local government, and others. Butler County Area Agency on Aging has been helping older adults with scheduling vaccination appointments through their local hospital health system. They have helped over 1,200 older adults get appointments and also help arrange transportation when needed. One of the reasons this works is that the agency is informed by the health system on how much vaccine is allocated for older adults on a weekly basis and are updated on a daily basis if appointments open up that they can take advantage of. Butler County Area Agency on Aging schedules accordingly and ensure that forms are completed in the system for older adults. As a result of these efforts, they have been able to achieve a 0% no-show rate, meaning no one has missed their appointment. Since senior community centers are temporarily closed during the pandemic, senior community center workers have been enlisted to work on this initiative. The workers keep older adults updated on their vaccines, on when their vaccine supply will be available, make appointments, call to remind them of their vaccine appointment, call to see how they are feeling after the vaccination, and remind them of their booster appointment. Butler County Area Agency on Aging is also assisting with vaccination efforts in 17 senior high-rise apartment buildings. They ensure that the provider registration forms is completed and help administratively by identifying individuals on each floor who requested the vaccine. This helps the health personnel to swiftly and efficiently get the vaccine into arms. Butler staff then monitors for any adverse reaction during the 15-minute observation period and notifies a waiting ambulance service of any serious issues that arise. Butler's story is inspiring, and while it may be unique, it is worth sharing as a success story. There are also other area agencies on aging that are in their planning and developing their efforts. A good example is Southwestern Pennsylvania Area Agency on Aging, which covers Washington, Fayette, and Greene counties. Southwestern has been serving on their local COVID-19 task force. Now, they are focusing on assisting older adults who have problems navigating the web or who don't have a computer. They're also working with their local PennDOT shared ride program to ensure a free ride for every adult who needs to get to their vaccine appointment. Just as importantly, they're working with their local health system to let older adults know that transportation is available. In addition to the efforts happening at the local level, the Department of Aging is leveraging its telecommunication and counseling resources in 2 statewide programs that many older adults already know, use, and trust. PACE, Pennsylvania's Pharmaceutical Assistance Benefit for older adults, is about to launch a comprehensive assistance and outreach effort to its 275,000 enrollees to help obtain vaccines. PACE has designated a team of phone operators in its Harrisburg call center to serve as a COVID-19 special scheduling unit, a dedicated unit for arranging vaccinations for PACE cardholders. These operators will also be working with cardholders to arrange transportation to the vaccination site, or eventually work with the PACE Pharmacy Network members to vaccinate a cardholder at a cardholder's residence if that's necessary. PACE's clinical team is also working to identify any PACE member who is at high risk based on their medical history and will be reaching out to them. In the meantime, PACE cardholders can contact 1-800-225-7223 if they have any questions or need assistance. For older adults who don't have access to a computer, the Pennsylvania Link to Aging and Disability Resources, which connects older adults and adults with disabilities to needed long-term services and supports, is also stepping up to take calls and offer assistance. When people call the PA Link for help with getting a vaccine, PA Link counselors will assess the caller's situation, offer guidance, and transfer them to a scheduling team. For those callers with transportation needs, the Link counselors will also be able to contact PA Link partners and area agencies on aging at the local level to assist with coordinating transportation. The PA Link number is 1-800-753-8827. There's a lot of good work going on, but there's much more to be done because, as Governor Wolf said, we don't yet have all the vaccines we need. In the meantime, we will continue to build upon, improve, and support successful models such as the ones that I have shared with you that demonstrate how collaboration at the community level can make a difference. Our department and the area agencies on aging have adapted throughout this pandemic, and we will continue to work together and position ourselves to further help older adults as additional vaccines become available. And finally, I want to thank our department staff and the area agencies on aging for their leadership and responsiveness in support of Pennsylvania seniors throughout this pandemic. Thank you, and now I will turn it over to Sarah Galley for questions.
Thank you very much, Secretary Torres. So we're going to begin our questions. I would like to ask each reporter to ask just one follow-up today because we do have a lot of reporters on the call, so we want to try to get to as many as we can. So our first reporter today is Jamie Bittner from Fox 43. You should be able to unmute, Jamie.
Thank you for holding this today. I have a question regarding how you're making this a little bit more easier for seniors as far as specifically those clogged phone lines and that website itself. Is there any improvements that are being made to help clear up those phone lines or to improve that website to make it more user-friendly for seniors?
Yeah, Jamie, that's a great question. We have a lot of work to do to improve that. There are too many people who call, can't get on, can't get anyone to answer, websites that are clogged up. We need to do a better job. So we are doing it. We're constantly changing, just made some major changes to the website yesterday, and we'll continue to look for ways to improve that. I think we have to do a much better job. Keep in mind, though, that the chief constraint right now is the supply. Right now, in the 1A category, we have, as I said, over 4 million people. And if you assume that each one at this point before the Johnson & Johnson vaccine comes out, they need 2 doses. So that's 8 million doses, over 8 million doses we need to be able to administer. So far, Pennsylvania has received a little over 2 million doses. So even if we were doing a perfect job, and again, we are not. And you point out one of the problems right now is that just a lot more demand than there is supply. But even if we were doing a perfect job, you'd still be left holding that main constraint that 3/4 of the people who right now, 3/4 of the vaccines that are needed right now in Pennsylvania, this minute, right now, we don't have. I think the federal government is doing a really good job of ramping that process up. I think Dr. Fauci just mentioned today that the federal government has a new, more expansive target in terms of getting vaccines out enough for everybody by the end of April. But we still have to do a better job here in Pennsylvania, and that is one of the areas that we're working really hard.
Do you have a follow-up, Jamie? Okay, we'll keep moving along. Next we have Dennis Owens from ABC 27. Go ahead, Dennis.
Hello, Governor. Thank you for doing this. Two-part question. One, you're in the proper age category.
We
can't hear you.
We're having trouble hearing you, Dennis.
You can't hear me?
Dennis, we'll try to come back to you, okay? Next, we have Barbara Barr from WGAL. So go ahead, Barbara.
Thank you, Governor and Secretary. There seems to be a lot of options out there for seniors, but I'm wondering if you think that there is one best option for a senior, particularly one who may not be computer savvy, to try to make an appointment at this point.
At this point, that's the question that I think the Secretary talked about, and the area agencies on aging are really trying to step up and make sure that seniors have a lot more options than they have right now. I mean, just getting a call through is one, but transportation, understanding what the different options are, I think are part of it. So even once we get fully to a point where we're really hitting on all cylinders, and we're not, when we get to that point, we're still going to need all these other services. And I think you want to add to that?
Sure, Governor. Thank you. One of the things that we're doing, and I could tell you area agencies are helping in one way. We have older adults that we support and are consumers in our database. So some of the counties are providing the list of consumers that they serve to healthcare organizations to help with scheduling and reaching out proactively. I think that's one of the things that you're going to see moving forward. Our PACE program will also be doing the same thing. We'll be proactively reaching out. But I would encourage older adults who need some support. If you don't have a family or relative that can help, please feel free to call your county area agency on aging. There's 52 of them across Pennsylvania that serve the whole Commonwealth, and we'll be happy to support you. But there is a lot of good work being done, and sharing information proactively is part of that. So hopefully we can reduce the frustration and the strain on our hotlines.
And just a quick follow to that, and you may be best to answer it. You mentioned Butler County as an example, but do you feel that all of those area agencies on aging are up to speed and are beginning to reach out? And have you contacted them?
I meet with the area agencies on aging every Monday morning. I've been doing that since the beginning of the pandemic. And part of what I'm looking at is I'm providing information. I'm also getting information from them as to what's happening across Pennsylvania. So the answer is they have different level of capacities. We have our largest area agency on aging in Philadelphia to some small ones in the smaller counties that perhaps don't have as much capacity. But some of the discussions we're currently having is, what support do they need to ramp up and position ourselves to proactively be able to support the Commonwealth as efficiently as possible once we see a steady supply of vaccines coming in.
Thank you.
Thank you. Next up, we have Michael Gorsinger from CBS 21. Go ahead and unmute, Michael.
Hey, Governor, good afternoon. I just got done talking to the Pennsylvania Healthcare Association, specifically focusing on long-term care facilities and how they've been treated throughout the pandemic. They use words like shocking and insulting, and that Pennsylvania has failed long-term care facilities. It's just some of the words they've used. One of the things they're pointing to is the fact that there's been less than 20% of the total vaccine allocated to long-term care facilities here in Pennsylvania. You compare that to Florida, which has done about 50%. Is there any plans right now to up the amount of vaccine doses that are going to long-term care facilities? And what kind of time frame might we be looking at for that?
Yeah, so Michael, I don't know where you're getting your information, but here's the information that I have. Nursing homes, not the long-term care, not the Department of Human Service, but the nursing homes, 100% of staff and patients who wanted the vaccine have gotten it. That's 100%. 70% have gotten the second dose. In the long-term care facilities, 70%, and because they started after the nursing homes, the skilled nursing homes did. At this point, 70% of those who want it, staff and patients, have gotten their first dose, and the second dose will come as soon as we get to the 100% figure. So I'm not sure where their figures come from, but this is the latest figures I just got today.
They had mentioned that they don't feel like they're being prioritized or even given a seat at the table in some of these talks that are going on in the planning stages for the state. How would you respond to that?
I'm not sure how they can get 70% first doses. I mean, that's pretty good. Are there things that we could do to do a better job communicating with everybody in the state? Absolutely. But the long-term care facilities, we're trying to do everything we can to make sure that as part of 1A that they get the priority they deserve. Now, again, part of the distribution was determined by the federal government, and that would come through CVS and Walgreens, and that they would take care of the logistics. So the state was not part of the initial conversation. We adopted the federal program. And maybe that's something that we and the long-term care facility should have a conversation with the federal government about, to say maybe there's a better way to do this. But I think the results have been pretty good so far.
Thank you, Michael. Next up, we have Dennis Owens from ABC 27. Go ahead, Dennis.
Hello, Governor. Thank you for doing this. Two-part question. One, because you're in the proper age category, have you gotten your vaccine yet? Secondly, on the It's Your Turn app, if you click smoker or one of those other conditions, it's suddenly your turn. But from what we're hearing, there's no double checking on the back end that you are in fact a smoker or have any of those other conditions. Does that concern you? And what's your message to people about the honor system?
Yeah, look, but first of all, I wrote this down. The first question, I have not gotten the vaccine yet. I will as soon as, I don't want to butt in line though. So I'm looking forward to getting the vaccine, and I was really heartened by the news I heard secondhand that Dr. Fauci said today that they're continuing to ramp up their efforts at the federal level. In terms of the honor system, it's a great point. I mean, in Pennsylvania, there are all kinds of ways that you could game the system. You could go to another state and do vaccine tourism. You could actually pretend that you get a fake ID and pretend you're 65 or older, or have somebody, a friend who's a medical professional, aver that you actually have a underlying condition that qualifies you for this. There are all kinds of things that people can do in every walk of life to game the system. I think most Pennsylvanians are being very honest about this, and that's what I think is ultimately going to make this process work. The key constraint is supply. The federal government is doing a phenomenal job, I think, of increasing supply every week by double digits. And I believe, given Dr. Fauci's comments today, that that's going to continue, and I have every reason to believe it will. In Pennsylvania, we need to make sure that whatever the supply is, we're doing the best possible job, and we're not, to get that out. And Pennsylvanians need to be as honorable and honest as we are, to make sure that we do this right. We don't game the system, that we take full advantage of getting in line when it's our turn and get the vaccine. The job of every Pennsylvanian is to do this honestly. The job of the Commonwealth is to make sure that the system is as efficient, fair, and equitable as possible.
Thanks, Governor.
Thank you. Next up, we have Flora Pastorero from PennWatch. Go ahead, Flora.
Hi, Governor. I have a two-part question as well. You said that the vaccine rollout has been slower than you would prefer, that we do need to do a better job, that we shouldn't have any excuses. So part one of my question is, what do you think the solution is to improve the rollout? And part two, is the state considering mass vaccination clinics?
Yeah. Let me ask the second question first. The mass vaccination sites are part of any plan. The initial step was to work with the federal program and get these out to long-term care facilities, nursing homes, frontline healthcare workers, and move through that over 4 million people, plus those are 65 and older, as quickly as possible. But even in that plan, there is, as we get to a broader segment of the population, mass vaccination sites are part of the strategy. In terms of slower than I would like, again, there are two elements to this. One is, well, I guess there's three. The one is that Pennsylvania, we can do a better job, and so tomorrow we're having a bipartisan legislative vaccine task force that will be meeting on a regular basis to try to figure out how we can do a better job. This is members of the Republican and Democratic caucuses in the Senate and the House, working with members of the executive branch to figure out how we can do a better job. We'll be working with professional consultants. We'll be bringing in people from the private sector. I've already had great offers of help from the State Chamber of Commerce, from individual organizations, businesses offering to help. And Pennsylvania has big logistics experience. So these are the things that we're doing to try to make our own capacity better than it is. So I believe that we can do a better job. We certainly need to do a better job. Second thing is, we're all constrained. I don't care how good a job we're doing or how lousy a job, we're all constrained by the lack of supply. As I said earlier, we could use 8 million vaccines right today. And so far, since the vaccines started rolling out in the middle of December, we've received a little over 2 million vaccines. So we have a long way to go. And even if we were doing a perfect job, which we are not, we still don't have enough vaccines. And then the third issue is, I guess, how you're counting. Again, I think the vaccines have been fairly distributed according to population, but the age structure of the different states is different. So Pennsylvania has a bigger percentage of older Pennsylvanians, older citizens than almost every other state in the country. I think we're, as I say, second or third in the country. Is it second or third? I think somewhere around there, third. And so that actually means that we have a higher proportion of our citizens in 1A category, 65 and older. And so when you look at Pennsylvania's rollout, we also suffering the same supply issues, constraints that every other state is, and we have a bigger demand right out of the gate than almost every other state in the country. So we have to work on all these things. I'm not making excuses. We need to do a better job, but we're all operating under constraints that are as real as anything you could can imagine. So we will continue to work on doing a better job. As I say, the first meeting of our bipartisan legislative task force on vaccine rollout is tomorrow. But we've already been talking and meeting on the phone, and I promise we will do a much better job.
Thank you. Next up, we have Sam Zern from PLS Reporter. Go ahead, Sam.
Hi, Governor. Can you hear me all right? Okay. My question is about equity in the vaccine rollout. So you just mentioned that we do have this large older population in Pennsylvania, but there's also a lot of unknowns on the dashboard. So I'm curious, how do we know that we're actually getting the vaccine out to people who need it and to communities that have been hardest hit?
Yeah, we are trying to, and I'm going to let the Secretary talk about how we're doing that with older Pennsylvanians. Mm-hmm. But let me just start by saying we don't know as much as we need to know, and we're figuring out how we can get a better handle on the statistics. But I can guarantee you that we need to do a better job there. So, Robert, do you want to talk about how we might know?
Sure. I actually have a meeting this afternoon with some of the affinity commissions under the governor's jurisdiction, and part of the conversation I'm going to have with them, for example, we want to make sure that allocation of vaccines are being done equitably, making sure that vulnerable, diverse populations are being served. So one of the executive directors oversees, for example, the Latino Commission, and I know they have 32 commissioners that represent different parts of Pennsylvania. So I'm going to be engaging with them in that conversation, as well as executive directors of the Women's Commission, the LGBTQ Affairs, the African American, and the Asian Pacific. So we are trying to bring in, as the governor has said, more partners, more state agencies to support this effort to make sure that we're targeting every community, especially those that are been vulnerable and hardest hit during this pandemic.
Thank you very much. Next, we have Erin McCarthy from the Philadelphia Inquirer. Go ahead, Erin.
Hi, Governor Wolf. You've said in the past that you'd consider a centralized vaccine registration if you found it would improve the speed of the rollout. But recently, I know you and Senior Health Advisor Malden have said that Pennsylvania is not considering that at this time. In light of the issues that you've talked about today, particularly to the 65 and older population, wouldn't it help with efficiency and kind of indirectly improve the supply issue if you had a centralized system?
Yeah, it could. You sort of almost sounded contradictory that we are considering it, but we're not. Again, the first meeting of the Legislative Task Force on Vaccine Distribution is tomorrow, and I think there's nothing that's off the table. One of the things I think you'd want to be concerned about is that we have tried to create a footprint of providers, places where you can actually get the vaccine that is accessible for Pennsylvanians all across the state. So, we now have, 1,700 that we have set up that have volunteered to serve as providers. And we have some problems. Among the problems is that some of the smaller ones have problems when people call, they can't get through. I wouldn't want to trade that, where you can at least walk to the place or drive to the place, with a centralized one where you also had problems. I think we need to make sure that what we do is make this accessible and easy to use so that people can actually get the vaccine as quickly as possible. And if that's a centralized registration, I've also heard people talk about regional registration systems, or if it's the purely decentralized one that we sort of picked up from the federal government. we want to do whatever it's going to, whatever we think we can get to as quickly as possible that will give people the access that they don't have right now that they need.
Thank you.
Thanks very much. Next, we have Scott Beveridge from the Observer Reporter. Go ahead, Scott.
Hi, thanks for taking my question. Are the second doses still secure? Because some of these smaller hometown pharmacies are saying they didn't get any shipment this week and that their second doses are at risk.
I think you might be talking about a memo that went out yesterday that was really, was not very clear. I mean, it's a good point. And we followed up. Members of the Department of Health staff followed up with direct phone calls to assure everybody that if you administered a first dose, there is guaranteed a second dose coming to you. So yes, there will be a second dose.
Thank you.
Thank you very much. Oh,
the second dose has to be within a time frame. And the federal government has been very, very clear on this. I think the Pfizer, you should get the second dose within 3 weeks. I think Moderna is 4 weeks. But the federal government has said if by, I think, 42 days you haven't heard from a person, there's a need to act affirmatively to find it. So it's not only guaranteed, it's we're taking affirmative steps, or will take affirmative steps to make sure that people who've gotten the first dose get the second dose.
thank you, Governor. Next up, we have Lizzie Hardison from Capital Star. Go ahead, Lizzie.
Hi, Governor. Thanks so much for being here today. I have a question about, I guess what I'll kind of call the customer service experience of people who are seeking vaccines, because it seems like one of the most persistent complaints that lawmakers are hearing, that we're hearing in the press, is just people having just an absolute hell of a time signing up to get vaccines. And so I guess, your administration in 2019 announced this initiative to improve customer service for people using state data systems. But, last year we saw just the total collapse of the unemployment compensation system. It was just inundated with calls. People had a terrible time accessing benefits there. People are having a really difficult time getting vaccines. I understand your argument about supply, but what steps are being taken to improve this user experience of people who are signing up? And I guess with a particular eye to equity of access for elderly people, people with poor internet connections, or people who have other visual impairments or other things that make it hard to sign up.
And that's what I said. We have a lot of improving to do. I mean, if you've used the try to access information on our websites, we still have a lot of improving to do. We've made a lot of improvements, and we're better now than we were on our vaccine website 2 weeks ago, but we're not where we need to be. So we are continually improving, and that's why I think anybody who can make a suggestion as to how they think we can make this more user-friendly, I think we're all ears. But that's why this bipartisan, unusual task force between the General Assembly and the executive branch is going to be so important. We're hearing all these things that you just laid out, and we want to make sure we're doing a good job. Are we going to get to perfection tomorrow? No. But we're going to do everything we can to get better and better each and every day, so that we do this. And that's what we did with the unemployment compensation. You're right. When we started out, that was an awful debacle. But it's gotten to a point where it's not bad. It's pretty good. And we still have all kinds of improvements to do. We're still working on how we can improve that. But it's not, did we go from zero to perfection overnight? We did not. But we will continually improve, and we're continually working to improve. And what I said in 2019 was true then, it's true now. We are continuing to work on making sure that we do a better and better job of providing customer service to the citizens of Pennsylvania.
Thank you very much. That is all the time we have for questions today. Thank you, Governor Wolf. Thank you, Secretary Torres. Thank you to all of our reporters for joining us today. The full broadcast of this press conference will be available later today on PAcast, and I hope everyone has a wonderful and safe remainder of their day. Thank you.